Okay, now let's look at case number 25. A 9-year-old girl is brought to a public clinic by her mother. The family immigrated to the United States from Guatemala 3 years previously. Her mother reports the girl seems very small for her age and has been continually lethargic for some time. So she's been continually lethargic for some time. Physical examination reveals a small girl with a thin scaphoid abdomen. Relevant laboratory findings are as follows. Hematocrit 36%, mean corpuscular volume 73 FL. And what is mean corpuscular volume? This is the measure of concentration of hemoglobin in a given volume of packed red blood cells. The white blood cell count was 11,000 millimeters cubed, and the differential here is 35% segmented cells, 1% bands, 33% lymphocytes, and 21% eosinophils. What is the most likely diagnosis? Hookworm or nematode infection. So if I pick this up, my students. Okay. Hookworm or nematode infection. The findings of eosinophilia and microcytic anemia with recent immigration from an endemic area are highly suggestive of this condition. What is the next step in confirming the diagnosis? Stool ova and parasite tests can confirm the presence of characteristic small round eggs and occasional worms approximately 1 centimeter in size. Stool ova and parasite tests can also be used to delineate the species of helminth. What are the species of hookworms? Okay. So what are the species of hookworms here? Ankylostoma duodenale, Nematode americanus, and Ankylostoma brasiliensis are the most common hookworms. Of the three, a duodenale and N. americanus cause the classic gastrointestinal symptoms and microcytic anemia seen in this patient. A brasiliensis, however, can manifest as a condition known as cutaneous larvae migrans, in which the larvae migrate to the subcutaneous tissue and create pruritic serpiginous tracts underneath the skin. What other helminth is known to cause anemia? Diphylloboethium latum, a tapeworm, causes vitamin B12 deficiency, leading to macrocytic anemia. How does this infection... This is ridiculous. I think I need to be serious here. There, that's much more serious. How does this infection cause disease in humans? Percutaneous infection occurs generally through the soles of the feet and is acquired commonly from sandboxes. The larvae pass into the lungs, and 8 to 21 days later they cross the pulmonary vasculature and enter the airways. They ascend to the pharynx and are swallowed. By the time they reach the small intestine, the larvae have become adult worms. The adults hook onto the mucosa and feed on the host's blood with the help of an orally secreted factor X inhibitor. This results in microcytic anemia. The females produce eggs that are passed through the stool and are deposited in the soil. What are the appropriate treatments for this condition? Since hookworm is a helminthic infection, mebendazole and albendazole are the first-line agents. These agents disrupt helminthic microtubule synthesis, leading to structural weakening and death of helminthic cells. Parental palmate can be used as a second-line agent.